Good afternoon. I'm Dana Cunningham, Dean of the Jonathan Tisch College of Civic Life. It's a pleasure to welcome you to today's conversation with Dr. Talia Quandelacy, Tufts alumna and this year's recipient of the Lyon Bendheim Citizenship Award. First, let me acknowledge our co-sponsor for this event, the Tufts Department of Community Health. Thank you for your partnership and support, and thanks for producing incredible and engaged students like Dr. Quandelacy, who was herself a community health major at Tufts. These students go on to create change. Additionally, we would not be able to host today's guests without the support of J.B. Lyon and Tom Bendheim, dedicated civic leaders who have been friends of Tisch College for more than a decade. J.B. and Tom are members of the Tufts class of 1985, who developed a friendship as well as a lifelong commitment to civic engagement and went on to have extraordinary professional success. Together, they established the Lyon Bendheim Citizenship Award to celebrate individuals, groups, or institutions affiliated with the university that have shown a commitment to civic engagement through successful initiatives, creative solutions, or bold leadership, and to connect them with students and alumni on campus. I know they are in the Zoom room today watching and may ask a question later, and I thank them for their friendship. The award honors leaders who make a difference and who live up to Tufts' core values of civic engagement and social impact. Dr. Quandelacy and her work embody those core values. She's been named this year's recipient of the Lyon Bendheim Citizenship Award in recognition of her exceptional work on federal and state level responses to the COVID-19 pandemic and her efforts to uplift health disparities experienced by Native American communities. Dr. Quandelacy is an assistant professor of epidemiology at the Colorado School of Public Health, where she specializes in infectious disease modeling, using analytical approaches to understanding disease spread and to identify areas for intervention. In addition to her time here at Tufts as an undergrad, she holds a Ph.D. in epidemiology from Johns Hopkins University's Bloomberg School of Public Health and master's degrees from Harvard and Emory Universities. She completed her postdoctoral fellowship at the Centers for Disease Control and Prevention in San Juan, Puerto Rico, where she modeled the spread of dengue fever and Zika virus. Joining Dr. Quandelacy in conversation today is fellow Tufts alum, Dr. Michael R. Jordan, University Infection Control Health Director and Associate Professor of Medicine and of Public Health and Community Medicine at Tufts. Dr. Jordan is well known on the Tufts campuses for his work spearheading the university's response to the COVID-19 pandemic. He also serves as the director of the Tufts Medical Center and Tufts University COVID-19 Biorepository and Comprehensive Database, and as the Tufts representative on the Inter-University COVID Response Assessment Group that includes representatives from Harvard, Northeastern, MIT, and BU. Dr. Jordan also conducts leading research on both COVID and HIV drug resistance. He serves as a consultant to the World Health Organization and is co-chair of the World Health Organization HIV Drug Resistance Surveillance and Epidemiology Working Group. And he's a member of the steering group for the World Health Organization HIV Resistance Network. Dr. Jordan is a double jumbo, holding both a bachelor's degree and medical degree from Tufts, as well as a master's degree from the Harvard School of Public Health. I look forward to today's conversation between two Tufts alumni who exemplify the university's values through their commitment to public health equity and working with government and decision makers to inform policy that changes lives. Thank you for joining us. It is my pleasure to welcome Dr. Quandelacy and Dr. Jordan.
Thank you very much. Dr. Quandelacy, welcome back to Tufts. It's truly a pleasure, and congratulations on receiving the Lyon Bendheim Citizenship Award. It's very well deserved, and I know I speak for the entire Tufts community when I say that we're thrilled to have you with us today. You certainly have accomplished a great deal since you were a student here. Let's jump right in. I wanted to ask you about your time at Tufts as an undergrad community health major. What was your time at Tufts like? And what were some of your early experiences on campus that led you to a career in public health?
Yes, thank you so much for having me. And thank you again to Tufts University's Tisch College and to JB Lyon and Tom Bendheim for this wonderful award. I'm very humbled to have been awarded this. Jumping straight in, I had a great experience at Tufts. I think some of the first 2 years were a bit of a challenge for me, actually, mostly because as a first generation student, it was a bit of a struggle, kind of learning the ins and outs of a college system, and having been from New Mexico, there was a bit of a cultural transition that I was still kind of learning how to navigate. So I would say there was a bit of a challenge in finding my place. I'm actually really encouraged to hear that there will now be a center for Indigenous and Native American students, because I think that was one thing, that finding my population was a little harder than I think, some other groups at the time. But I think Tufts was a really great experience for me in terms of community health, because it really was my entrance into public health, and it was the foray to start to learn about, what is community health, because I always knew, having grown up on the Zuni reservation in New Mexico, that I wanted to work with health in some way, and, health that could, health in some aspect that could, improve the services and systems of my populations, but I wasn't really sure, outside of being, a medical doctor, what that could look like. So learning, what is community health? What does it mean to do health at a population level, and taking classes at the community health program at the time, such as, health policy and kind of this intro to epidemiology was really kind of the beginning of my public health career.
Very interesting. So Tufts, specifically Tisch College, has a very proud history, as you know, of public service and civic leadership and engagement, particularly in health science fields. For you, what does it mean to be civically engaged, to be a civically engaged public health scientist, and to center equity in public health? What does that mean to you?
Yeah, so I think especially for, working in public health, in a lot of ways, a lot of what you generally do does kind of inherently include a lot of civic engagement. That can be working with communities internationally, or kind of in your own neighborhood. I did some global health field work in Peru for a while, trying to understand, risk factors to certain zoonotic diseases that, Indigenous communities that move into Lima are exposed to, but this could also, include something like volunteering at community health clinics, and, doing things like public health educations and campaigns, and, even just talking with your community members or your family about things like, benefits of vaccines. And I think it really, focuses on the health of populations. And so, through advancements of programs or interventions, kind of these inherently require some aspects of civic engagement. And for me, I'm not explicitly, a health equity researcher, but I've tried to find ways that integrate aspects of equity into the work that I do. And so, a lot of what I study is infectious diseases, and these impact, populations that tend to be, kind of ignored by the greater, system. And at least for, dengue and Zika, these tend to impact Indigenous populations the most. And so, trying to center some of the questions that I look at on populations that I'm still, interested in improving and advocating for.
That's terrific. Following up on that, what are some of the perhaps most important lessons that you've learned to share with our budding future public health leaders and activists in the audience?
Yeah, I mean, I think one of the biggest ones has probably come from the pandemic and really highlighting the importance of science communication. I think, that's something I never really received a lot of formal training in, but it has kind of become clear that that's one of the most important kind of ways to engage individuals in, just kind of understanding what some of the issues are, but also helping them to see what, some of the benefits of certain interventions can be. And, if you can do really good science, but also if you can't kind of verbalize that or communicate that to either policymakers or people that this might reach the most, that's another area where you can do a lot of good. So I think that's been a more recent lesson. I think another one is there's no linear path to going into public health. And I think, I've tried a few different avenues and not necessarily failed in those different directions, but they've really helped me kind of find the current, area of research that I work in now. And so it's, there isn't one right way to kind of emerge into this field.
I'd like to, just following up on the concept of scientific communication, it is certainly very, very important. We all read the newspapers frequently about what may happen next with COVID-19. And I know a lot of your research focuses on infectious disease modeling. And I wondered if you could share with us exactly what infectious disease modeling is, why it's so important, and what it means sort of day to day in your work.
Yeah, that's a great question. So I am an infectious disease epidemiologist, and I focus on a certain set of methods that are called infectious disease modeling. And you're right, this has really come into the forefront with the pandemic. And when people say modeling, it really kind of refers to a specific subset of approaches that use, these we call mathematical models. So it uses kind of a set of differential equations that really just allow you to look at what happens with an epidemic at a population level. But the benefit of these types of approaches is that it lets you kind of create scenarios. So you can look at something like the intervention of a vaccine or the implementation of something, at least with COVID, like these new therapies like Paxlovid, and it allows you to look at projections of how these might impact a population in the future. So it really is informative because policymakers, scientists and policymakers can then see if we try to reach a certain proportion of the population with, say, a vaccine, this is what might this is like the decline in cases we might see if we're able to reach them. So it's you can answer a lot of interesting scientific questions in that aspect, but it's also really useful in terms of informing policymakers if they're trying to, make decisions ahead of time on, what types of guidance they might make to the public or what types of measures they might implement.
So it's really that translation from science to policy that you're helping with.
Yeah, I would say that's kind of one of the bigger interfaces, at least, especially during the pandemic, with the response and kind of trying to interact with other public health workers and policy or decision makers, on translating the science of these models into action. Yeah.
So you were really on the front lines of the nation's response to the pandemic as a member of the US CDC's COVID-19 response team. What was that like in those early days, those early weeks and months, trying to track and forecast the spread of COVID? I imagine you used a lot of your modeling skills. What was that like, and what were some of the opportunities, challenges that you encountered, and how did you really go about shaping policy?
Yeah, so I think we've read a lot about what some of the challenges were, in the media, and I won't go too much into detail about a lot of that, but I think early on, it's kind of like the emergence of other new pathogens where there's just a lot of information that isn't known, and to engage with decision makers, you're getting questions about the science of this new disease and what does this mean? And so trying to convey information with very little kind of actual understanding of a pathogen is really what we were kind of dealing with, or trying to create models and not knowing the actual biology or epidemiology of this pathogen, and really trying to use other examples of diseases that we've seen in the past to try and inform, what SARS-CoV-2 at that point looked like. So it was, a very challenging experience with that, because you are getting questions about what is the potential impact on our population, and without really having a better understanding of the severity and and some of the kind of different aspects of who can spread COVID that we didn't really know about at the time, trying to make kind of the best guess with the science and evidence available at the time that we could make. And yeah, so that's, I think, both a really exciting or opportune time to be involved, because you're kind of at the forefront of a lot of this work, but also that is also, again, a different or it's also a challenge of it, just because you don't have that much information to use at the time.
I can imagine. So I also read that you spent time during the initial months of the pandemic tracking the spread of COVID-19 in Indigenous communities. What were you seeing in those communities, or perhaps not seeing, that really motivated you to do that? And, tell us about what's come of some of that work.
Yeah, so I think, this has still been a bit of a challenge in terms of like data transparency throughout the pandemic, but really kind of came to fruition in the summer of 2022. But with the reporting of cases from different states, there really wasn't a lot of cases or kind of other health outcomes being reported by race. And, at least especially noticeable was kind of the lack of reporting of, the impact of COVID on Native American populations. IHS had a dashboard that would update, cases across their IHS regions 1 week to the next, but in terms of kind of larger platforms, it was hard to get a sense of, what communities were being impacted, and what to what extent. So that was kind of the impetus for trying to create this map that I made. And it was actually using information that a journalist from Indian Country Today had put together. So she had created a spreadsheet that tracked, the number of cases from different communities that she routinely reports on, and was trying to put together some other, measure of how many cases are happening in different tribes across Indian country. So I had started to map that just because I, knew how to visualize that geographically. And so after, maybe a month or two of doing that, it was so much work. And I wasn't even the one really collecting a lot of that. It was the journalist, but I was, in collaboration with her for a little bit of it. But the Johns Hopkins Center for American Indian Health actually reached out because they had an interest in kind of taking the project on in a larger scale and capacity. So they've since have people and students volunteering and kind of collecting this information with, a community advisory board. And this map now is available on the Johns Hopkins map as one of the tabs. If you go to the website, you can see kind of what cases are, what the total cases are in kind of Indian country. And so they're still currently maintaining it. And I think that was kind of a great addition to the map, especially considering, the dearth of information that we still kind of have on American Indian populations right now.
Well, I'm really happy to hear that your work will have longevity, and that others at Johns Hopkins are picking up on that. But as I understand it, your work on COVID and Indigenous communities is really just a small part of what you do. And like many of us, the pandemic has diverted our career in that direction. I wondered if you could share with us some other projects and research interests that you're working on or that you're excited to work on in the future.
Yeah, definitely. Yeah, I still am doing research on COVID and other aspects in addition to just kind of the response and trying to inform policymakers. I also study how the transmission of COVID has changed kind of as we've had different vaccines being available. What the impact of that is for things like herd immunity, or when people or which geographically populations are kind of still vulnerable through kind of not being vaccinated. But I also study other respiratory pathogens. So those given changes with social distancing and masking are coming back, and so this is a really rare experience right now, because for the past 2 years, we've just seen really low cases of influenza and other, common cold viruses that we usually see from one year to the next. And we're not really sure what's happening when they're going to come back, but we're starting to see flu cases increase. And so I'm also trying to study, the implications of COVID-19 measures on these other respiratory pathogens. And not only that, but there's still other infectious diseases that have been circulating even with the COVID pandemic. And so I've continued doing a lot of work looking at dengue and trying to study, how widely it's distributed throughout the American region. So, for dengue, it's primarily found in Southeast Asia and Latin America and the Caribbean. And so a lot of what I work on is partnering with ministries of health to study, or forecast how dengue is looking over the next month to 6 months out, and trying to understand, when can we anticipate an epidemic, and especially given the burden of disease of dengue on young populations, and again, young Indigenous populations. It's really important to try to minimize or reduce these epidemics. So working on still a lot of kind of public health systems and surveillance work, but also hoping to, in the future, shift towards what the impacts of climate change are going to be on dengue, considering, with these new IPCC reports coming out, and that we are, seeing accelerated changes in climate and temperature, what these will mean for diseases like dengue or Zika in the future.
That's fascinating. Clearly, what I'm thinking here as you're describing this, it's really a multidisciplinary or even transdisciplinary team effort that will be required to really understand and characterize all these different diseases. I'd like to, to circle back just for a moment to COVID-19. I know it still is something on everyone's mind. Given your expertise and experience, what is your perspective on where we are with COVID right now?
Well, I think, we are certainly still in a pandemic. We're seeing variants arising. I think it's great that we have, pharmaceutical interventions like vaccines now to reduce the severity and, potential death for people who are, fully vaccinated. But I think it's still not clear, if we're going to see a new variant arise soon. We've just had this new BA2.12.1 emerging, and we're, still understanding kind of what that means in terms of disease spread. But, we still have a lot of populations that are unvaccinated and that are still, trying to access a lot of the tools that they need. And so things like, testing or at home testing, that, the burden is really on individuals and kind of waiting to be reimbursed by that. And a lot of the people who probably need it the most are, we're calling essential workers. And, having to pay for tests is kind of a big burden on people who, might be depending on that paycheck to paycheck wage. So I think there's still aspects of access that we're struggling with. And, I'm hopeful that we can continue trying to improve these, especially given, the new equity task force that was created at the start of Biden's presidency. But I think, we still have a challenge of getting people vaccinated and getting people the tests that they need. And, there are still issues with accessing Paxlovid for people who are, recently infected. So, I think we've made a lot of really good progress with getting a lot of people boosted and vaccinated, but I do think there's still a good amount of work to be done, especially for, reaching populations that are being most impacted at this point.
You've raised a lot of very important points with respect to equity. You talked just very briefly about surveillance, and if you don't mind, I'd like to ask you a follow-up question on that. With more and more testing being done at home, how are we doing as a country with respect to surveillance, and are we well prepared to detect emerging variants? And if not, what could we do differently?
Yeah, that's a great question. I think that's one of the current challenges we're experiencing right now because, it's I think it's fairly different across states how they're collecting any of this at-home testing data. And we know there are people who are testing positive, but depending on your public health system, there may or may not be a way to report that, or people might not even know that they, should report that information. But because we're seeing more at-home testing, it's not necessarily showing up in our surveillance systems through, other testing clinics or, inpatient clinics where people might also go to get a PCR test. So it just makes it harder to have a better sense of how many people are actually being infected. And so I think, especially, with knowing or with trying to identify if there's new variants, that just kind of creates an additional challenge and I think calls for, additional improvements to surveillance to be able to, report these at-home tests, or also for people who are going in and getting PCR tests, having some of those tests being kind of routinely sequenced so we know if there are new variants arising and that we can detect them in enough time to make some actionable decisions.
Very interesting. Hopefully people will hear your advice. I tend to agree with you. I think that's very well said. So before the COVID-19 pandemic, Dean Cunningham had mentioned you were working in Puerto Rico, where you were focusing on dengue fever and Zika. Much of your work, no matter which virus or disease you're studying, really seems to be centered around using data to predict what's coming next. So it's incredibly important work, and I think all of us appreciate and understand now more deeply than we did 3 years ago about mathematical modeling and how important epidemiology is. But I can also imagine, just on a personal side, that it can be sometimes anxiety-inducing work to constantly be thinking about the next public health crisis, the next pandemic, and what that response would look like. Do you think that's a fair assessment? And if so, how do you cope with that?
Mm-hmm. Yeah, I think that's a great question. I think one of the things that has come out with the pandemic is just kind of the level of burnout of a lot of people on the response and, in doing a lot of this patient care. And it is a real issue. And I think, I know one thing I've really had to work at is kind of balancing, work with other things just to kind of get a small break from the response. But I think one of the important things about, a lot of the work that at least I do with forecasting and, thinking about kind of when we might see the next epidemic is really for the purposes of being able to do prevention and having, kind of preparedness as part of a systematic way that we approach public health. And so, the purposes of doing forecasting is to have enough time to be able to implement, preventative measures, whether that's something like a public health education campaign, kind of telling people, we think this might happen, here are some ways you can protect yourself, or doing, at least for dengue, something like, insecticide spraying to try and minimize like mosquito populations, or other things like, preparing hospitals for surges and having enough hospital beds for people who might get sick and need to come in, and having enough staffing for that. A lot of this is things that you want to do ahead of time so that you're proactive in trying to minimize, the potential impact of these types of epidemics on as many people as possible. So I think it's, it's a helpful way of framing, I think, in that aspect, because even if it is anxiety inducing, at least, these are some steps we can really take, as opposed to being kind of more reactive, which, sometimes we have been in this pandemic. And I think it's a really good lesson for the future and kind of how important preparedness really is in being ready for the next wave or the next epidemic that might emerge.
So what advice would you give to future public health scientists and professionals, particularly those from underrepresented communities as they embark on their careers?
Yeah, I think, it's, I think there's certainly a lot of different paths you can go down. And, I for one have, really enjoyed working in public service. It's something I strongly believe in. And as I said earlier, I don't think there's a linear way to get into public health. And I think, I've tried a few different avenues, and I really enjoyed that experience because it allowed me to try out different things and really find kind of what wasn't for me and what did work for me. And I think, especially, for, emerging scientists from underrepresented communities, at least I think in my experience, I had a tendency for people to want to kind of push me into certain directions that, maybe wasn't exactly my interest, but they might align more with my community. But I still, managed to find a way to work in epidemiology and study questions that still impact, the populations that I'm interested in helping and advocating for. And so I think, there are ways that you can work, on a population, if it's the population you're from, without necessarily having to kind of study that particular, group, or, there are ways you can still work with your communities, even if you're not directly doing research, on those communities as well. And I think one of the other big things was, and this was, I think, something that was really crucial for me, was to find a mentor. They don't necessarily have to be, an academic mentor, but I know early on at Tufts, I had two great advisors, Dr. Edith Ballback and Ross Feldberg, in community health and biology, and they were incredibly supportive and, helping me kind of figure out where I wanted to go. But even along the way, I found different people who would advocate for me, or especially, not having had an academic family, kind of trying to figure the system out for myself. These mentors were just really great in giving me guidance and, coming to bat for me when, if I needed a letter of support, or just kind of answering my questions, no matter how kind of simple or naive they might have been about, what do I do to get into public health, or how do I, navigate the system. And I think, your peers are also great people to learn from as well. So I think, having a good support system like that is always kind of crucial in this field, and probably any field. But I'm also very happy to talk to anybody who might be interested in going into public health.
Thank you. So before I open up the program to the audience members, I would like to ask you something that Tisch College is thinking a lot about and has asked many of its guests this semester. And it really speaks to the themes that you've spoken about today, really equity and advocacy around public health and the need for equity. So what can we do in this moment? If there were one action that we could take, what should it be to help create health equity?
I think, one of the things that we can really do is, I think it's a lot easier than people think to get engaged in health equity, whether that's volunteering at your local community health program, or, even just talking to your family who might have concerns or be hesitant about, a vaccine or something else like that. I think, there are a lot of ways to engage and make a difference. I think, at least in my perspective, one of the things that's been really crucial is kind of this improvement of data transparency, but doing it in a way that isn't necessarily extractive with the populations you're working with, but doing it in collaboration with these communities that you are advocating for, and really listening to what these communities want. and trying to provide them with some benefit, at least, from my perspective of doing a lot of data analysis, with research, it can be like, give us your data, and not every time it's reciprocal. So, if you're working with a community, ask them what they would like to have answered, listen, give them results back, or give them some feedback about, what you found with, their populations, and how, the information you found could actually be helpful for them to move in an actionable way. And so I think, those types of aspects, really help improve health equity, and hopefully will improve, data transparency. And so I think, that's certainly one aspect, but, organizing education, things like environmentalism, all of those also have implications for health and disease, and, especially impacting vulnerable populations. So I think there's a lot of ways people can get engaged, especially, with kind of climate change right now. Taking steps to just bring awareness to it, I think is something that is fairly actionable at this point.
Thank you. So, I'd like to start to give the audience a chance to ask some questions. So those of you in the audience, please feel free to write questions in the Q&A box or in the chat at the bottom of your screen, and I'll be reading them. First up, we have a very special guest, Tom Bendheim. Tom is a Tufts alumnus, a member of Tisch College Board of Advisors, and together with his close friend and old Tufts roommate, J.B. Lyon, are the benefactors of the Lyon Bendheim Citizenship Award. Welcome to Tom to Tufts, and so glad that you're here with us today.
Thank you, Michael, and thank you, Talia, for sharing all of those inspiring words with us. It's really terrific to have you here today, and we're so proud of all that you've done and that you're a Tufts alum, and congratulations on receiving the award. I have a question that relates to what you were talking about, but is very specific to Tufts students. You had shared that an epidemiology course at Tufts inspired your interest in community health. What advice do you have for Tufts undergraduates who are also inspired to follow this career path? Are there any specific opportunities that you're aware of at Tufts, Tisch College, or even beyond that you think would be helpful for those interested in this work?
Yeah, thank you. Thank you again for this award too. And, I'm very honored to be the recipient of the Citizenship Award. And I think that's a great question. I think one of the great things about Tufts was that I had a lot of opportunities to get engaged in, volunteer programs or summer programs. I started out as, a student member on the Student Health Advisory Board, and, was a public health at Tufts, member, which was a student led group. And there were a lot of ways that we were able to engage with, the community around us. So we volunteered a lot at the Somerville Boys and Girls Club, and doing things like, providing information and, nutrition, doing things just like physical activities with the kids after school. So I think that was one of the greatest ways to just get involved with more kind of health related activities on a very small scale. But also, volunteering as part of my internship was another way that I kind of started to understand, what are the impacts of public health on a community. So I volunteered at the North American Indian Community Center in Jamaica Plain, and I really got to, interact with a lot of great workers there who were doing, a lot of work on diabetes prevention and, providing pneumococcal vaccines for, older populations. And that kind of really underscored the impacts that, small interventions like that can have on populations. So I think really taking advantage of those types of opportunities, like these internships, these volunteer programs. I know Tisch College has a lot of really great summer and semester programs, and I think there's a great way to take advantage of those and frame them in a way that focuses on health in some aspect, just to get an introduction into, what you can actually do in the public health field.
Thank you.
Thank you, Tom. So Dr. Quandelacy, I'd like now to ask you some of the questions that are coming in the chat. So thank you to the audience members, and please keep them coming. The first question is the following. We saw and continue to see politicization of public health and science around COVID and vaccines in a way that we really haven't seen, or at least I haven't seen in my lifetime. What do you make of this? Do you feel affected by this dynamic, and what do you think the role of a public health scientist to combat this should be?
Yeah, so I think, it kind of is an offshoot of what, there was a lot of anti-vaccine sentiment with measles. And so that was kind of an early kind of start of where this has really emerged from. Obviously, it has gotten a lot worse with the COVID pandemic. But I think, a lot of what we can do is, listen to people's concerns and understand that, some people might be very set in their mind about, where they stand on vaccines, but there also are people who really are just not sure about, the safety of a vaccine, or, have concerns that really aren't being addressed or kind of listened to. And so that's one of the biggest things we can do, is give them time, but also be willing to understand what their concerns are and answer them honestly. And people who are considering a vaccine, but just need a little more time, sometimes they eventually do get vaccinated. So I think that's one of the things we need to keep in mind is, some people do just need more time, but we shouldn't kind of turn our backs on these people who have decided not to get vaccinated. And there are still opportunities to help them get vaccinated if and when they change their mind, and also in the meantime try and provide them with other measures that might also keep them protected. But I think that is something that I think takes practice. I know I've struggled a little bit in trying to think about a better way to do that with some of the people in my family that have had concerns. But I think it's something that's really worth taking the time to think about. And I think there's a lot of great trainings for how to kind of engage with people who are hesitant. And I think that is something that I think, as public health scientists, we know what the evidence is, we know what the benefit is, but, we could probably do a little bit better in being a little more patient and really listening to people's concerns.
I'd like to follow up on that. Early on, you mentioned the importance of science communication, and you've certainly touched on it in your answer now. So, was that something that was a big focus during your public health education, that science communication? And how do students learn those skills?
I, for one, wish it was a little more prominent in my science education. I think there are some classes that people can take now, and I definitely encourage people to, whether it's through Coursera or, just a course being offered through a communications program to take one, because, I, in maybe an outbreaks course or some other kind of policy level course, you kind of had a day where you worked on science communication, or kind of advocating, to policymakers on what your research is and why it's important. But it was never, one of the main things that was part of your training. But I really think now, kind of seeing how important that has really been during the pandemic, and kind of how much public health researchers and practitioners need to be with science communication, I think it is really important to have some training, or at least just some more experience with improving how we communicate with the public.
So the next question, what was your favorite community health class at Tufts, and why? I'll go on and ask.
So I would say I actually had two classes that were my favorite. One, and they're both kind of related. One was a half-credit course called Parasites. And it was a joint course between biology and community health, but it was one of the first classes that I kind of learned about, how infectious diseases really impact humans. In different parasitic diseases, you walk through a couple different examples. and you did a case study. It was taught by Ross Feldberg, but it really kind of showed that you could study, infectious diseases of humans, and that was something that I was really interested in ever since I was little, because I grew up around the time when the hantavirus outbreak came in New Mexico, and kind of was in that area. So that had always been kind of a real interest of mine, and I just was never sure how to go into it. So that was a nice foray and introduction to that topic. And then the other one was this health disparities, race, ethnicity, and health course that I took, and it was taught by Linda Sprague at the time, because it really introduced you to different kind of foundational concepts and why, there are structural issues related to health disparities, and highlighting, these structural determinants or social determinants of health, and framing it in a way that, centers the population, the communities that are being impacted, but also kind of reframing, what are the other social factors that contribute to health, disparities, and, how are ways we can address these inequities. And I found that really kind of foundational in my thinking of public health, and it's really kind of framed my mindset since I've moved on from Tufts.
The next question is about your views on social media and how it relates to public health and public health crises. Particularly, the question is about during the COVID-19 pandemic, what have been the challenges, but also maybe the benefits of sharing public health information via social media channels and connections?
Yeah, I mean, there's a lot there. I think, one of the biggest advantages was just kind of the rapid dissemination of, new science and kind of new advances or decisions that have been made, through by policymakers, and kind of receiving that information much faster than we usually do, in older methods or older approaches. So I think, in some ways it's been useful, because as soon as there's new science out, you can see it almost immediately. And if you use Twitter, that's kind of one of the fastest ways scientists have started using this type of dissemination. And it's also been useful in trying to message some of these benefits of interventions. But in contrast, there has been a lot of amplification of disinformation, and that is become a real challenge of the pandemic, and trying to separate fact from fiction, especially if certain things are said in such a way that there's some truth in there, but maybe not the rest of the statement. And that has been a real challenge in trying to get people accurate information, and again kind of speaks to our need to be better at communicating with the public, and also trying to understand where people are getting their information, and trying to convey or reframe what they might be hearing on social media, and to try and get them more accurate information, so they can make the decisions about their health that they need to.
I'd like to ask you a follow-up to that. Where do you think all this misinformation is coming from? Why are people generating so much misinformation?
I mean, it's there's a lot of different sources. Twitter is one source. Different Facebook groups, are very clever at masking, what looks like real kind of scientific information, but has some slight modifications. And if it's sometimes when I come across one, it's hard for me to even realize that it's not exactly the correct statement. And people, and I'm trained in epidemiology, so if it's hard for me to kind of differentiate what the the truth and the lie is in there, then I can imagine for someone who isn't a public health expert, it's that much harder. So I think there's, sources like that. And I know, there's been attempts to try and improve some of this disinformation that's been going on Twitter and Facebook. But I think, it is a real challenge. And there are certain media organizations that kind of help amplify this to a much higher extent too. And so is kind of the role that media plays in general, and their responsibility for kind of relaying that information to the public is, it's kind of a real topical issue, and something that probably should address a bit more.
Right. It certainly underscores how important your work is in scientific communication, and certainly hope that your voice is loudly heard and not drowned out by misinformation. Another very interesting question from the audience. When you were an undergraduate at Tufts, did you participate in any research jobs with any professors? If so, could you describe the process to get the job?
So I did not, and I think that was more my inexperience and kind of my misunderstanding of maybe the academic system, not really having been, having been a first generation student and not really navigating or knowing that that was something that I should be doing. But I know that there are a lot of opportunities for public health students, and a lot of times you can engage with your professor and just, strike up a conversation, tell them these are what my interests are. And a lot of times, they know of other faculty members working on different projects that might be of interest. And that's, one of the easiest ways to get connected. And that's certainly not as an undergraduate, but the way that I went about getting other, research assistant jobs in my master's degrees, having had an interest in zoonotic diseases. I attended somebody's lecture and just kind of, was not afraid to go up and talk to them and just ask them questions and say, I think your research is really interesting. And I think that's a really useful networking tool that, is a little understated. And as an undergraduate, I think that's something that is certainly worth doing, is, engaging if you're at a seminar, with the speaker and telling them what your interests are. And that's how, I was able to get one of my research assistantships working in hantavirus at the CDC. And it was just because I went up to somebody after their talk and said, I really enjoyed your talk. I'm really interested in this, how do I get involved? And he just happened to know the person who works in hantavirus at CDC and put me in touch with them. And, the rest is kind of history. So, don't be afraid to engage with people, and everyone likes talking about their research, so they're always happy to engage with you.
That's a wonderful answer, right? Don't be afraid. Go and ask and seek out your professors and develop strong mentorship. I have a question for you. So there's a lot of talk in the media now about the pandemic being over. You sort of alluded to maybe it's not quite over. What should we prepare ourselves for, as towns, communities, states, as the university, as we look toward the summer and the fall, do you think, with respect to COVID and the future?
Yeah, I wouldn't say the pandemic is quite over. I think we are still seeing, at least, where I am in Colorado, we're starting to see the BA2 wave now. Mm-hmm. So, there's still a lot of people getting infected at this point. I think, with the warm weather and kind of a lot of restrictions moving, it doesn't always feel that way. And I think there is a real fatigue among just the general population, because we've been dealing with this for 2 years. And I think that's something we should really acknowledge. But it's also important to know that there are still a lot of vulnerable people and people who aren't fully vaccinated that we could, not target, but, work to get them up to date in their vaccines. And we still have a lot of work that we can do in terms of getting people fully protected and with, the preventative measures that we already have at hand. But also understanding that, we're dealing with a pathogen that, it's going to do what it wants. And so we might be done with the pandemic, but, we could have a variant that emerges over the summer, over the winter. And we just really can't, as much as I like to forecast and do projections, that's something that's incredibly hard to anticipate. And so kind of knowing that we might still have a wave that arrives in the fall, but we do have the measures, pharmaceutical and non-pharmaceutical, like masking or vaccines that we have available to us that do allow us to, reduce people's risks of getting infected and having severe disease, or having something like long COVID, which is a real risk, even just for a mild infection, and it's worth trying to prevent that as much as possible. So understanding that this will probably end at some point, but we can't anticipate what the virus itself is going to do yet, and at least just kind of be ready to provide protections for ourselves when we need to.
Dr. Quandelacy, thank you for joining us today. Your work is truly inspiring. I've learned a lot from you today, and I think you've touched on extraordinarily important themes in American society, and you're truly very deserving of the Lyon Bendheim Citizenship Award. Congratulations again. I would also like to thank JB and Tom for their unwavering support to Tufts and to Tisch College, and a warm congratulations again to you, Dr. Quandelacy. We look forward to welcoming you back next time, hopefully in person. Thank you very much to all of you for joining the webinar today.
Thank you so much for having me. It's been a great pleasure.